Local anesthesia buccal block. The equipment needed for this procedure is as follows: personal protective equipment, syringe, 25-gauge long needle, same needle setup as the IA block if given together, or a 27-gauge short needle if given alone, gauze, anesthetic cartridge, topical antiseptic, optional, topical anesthetic, cotton tip applicator, and hemostat or cotton pliers. The buccal block, or long buccal LB block, is used for anesthesia of buccal gingival tissue of the mandibular molars. This block is not always necessary, such as when the buccal tissue is not impacted by the dental procedures performed, as in restoration of occlusal caries. However, for non-surgical periodontal therapy of the mandibular molars by a dental hygienist, especially with furcation involvement and root concavities when visibility is necessary, the LB block is often necessary and should be administered immediately after the inferior alveolar block. The target area for the buccal block is the long buccal nerve as it passes anteriorly to the anterior border of the ramus and through the buccinator muscle before it enters the buccal region. Thus, the injection site is the alveolar mucosal tissue distal and buccal to the most distal molar tooth in the arch, on the anterior border of the ramus. Load the local anesthetic syringe as demonstrated in the procedure loading the metallic or plastic cartridge type syringe. Before injection, follow all steps as demonstrated in the procedure, basic injection technique. For the LB block, assume the correct operator position at 8 to 9 o'clock right side or 10 o'clock left side for a right-handed clinician, or 4 to 3 o'clock right side or 2 o'clock left side for a left-handed clinician. Ask the supine patient to again open the mouth, but not as wide as for the IA block. Retract the buccal soft tissue laterally, pulling the tissue taut. Dry the penetration site and prepare the alveolar mucosal tissue with topical anesthetic in the vestibule, distal and buccal to the most distal molar in the quadrant at the height of the occlusal plane. A previous inferior alveolar block will not anesthetize the buccal soft tissue. Dry the tissue to remove any excess topical anesthetic. Using a 25-gauge long, same needle setup as the IA block if given together, or a 27-gauge short needle if given alone, orient the bevel toward the bone and large window toward yourself. Establish a fulcrum that allows you the greatest stability of the syringe. Direct the syringe barrel parallel to the occlusal plane, but directly superior to the mandibular molars. Insert the needle into the alveolar mucosal tissue, distal and buccal to the most distal mandibular molar in the quadrant until you gently contact bone at a depth of 1 to 4 millimeters. Pushing the softer tissue of the buccal fat pad over the injection site after initially retracting the outer cheek may make the needle entry more comfortable for the patient. Aspirate by pulling the thumb ring back gently on 1 to 2 millimeters at the injection site to prevent the possibility of an intravascular injection. If aspiration is negative, slowly deposit 0.3 to 0.45 milliliters of solution, 1/3 to 1/4 of the cartridge, over 10 to 20 seconds. If the tissue balloons, the injection is too rapid, and you should stop the deposition and remove the needle or slow down the procedure. Carefully withdraw the syringe and immediately recap the needle using the one-handed scoop method with a needle sheath prop or other recapping device. Rinse the patient's mouth and wait until anesthesia takes effect before beginning treatment, approximately 3 to 5 minutes if administered with the inferior alveolar block or 1 minute if administered alone. Complications that can occur with this injection include pain if the solution is administered too rapidly or leakage of solution at the injection site. Because the buccal tissue is so tightly adhered to the bone and the injection is quite shallow, this can cause leakage and also ballooning of the tissue during the injection. If you observe ballooning during injection, gently massage the solution into the tissue.